Hello and good morning. Hi to all the parents who are already on the call, and I'm sure many will join us in a little while. We've got Dr. Daniel in the house. Welcome.
Thank you.
I'm super happy to have you here. So Daniel is an applied kinesiologist, and actually I think you should introduce yourself because you're going to do a much better job than I do. I just want to say we're sending lots of clients to Daniel. And we're super grateful for you being in Singapore and offering your services to our moms and their babies and so on. It's really amazing. And that's why I've invited you on the call, because I want people to find out more about you and more about how, seeing a chiropractor way early in pregnancy can be so beneficial for birth outcomes, both for moms and babies. So this is what we're going to learn about today. I'm going to switch and you can start sharing your presentation if you'd like to speak of you.
Okay.
And parents on the call, if you've just joined, you can always write your questions in the chat and I'll bring them up as we go along. And I'm sure at the end there will also be an opportunity for you to speak to Dr. Daniel directly as well.
That should be working now.
Perfect, yeah. Great, thank you. Take it away.
So as Johanna mentioned, my name's Daniel. I'm a chiropractor as well as being an applied kinesiologist. So I'll go through and explain what that is in a little bit. And as Johanna mentioned, we have worked together for a while now, and I'm very, very grateful to be working with BumpWise. I do see a lot of patients, and we have, as Johanna mentioned, discussed about the importance of coming in early during a pregnancy. So I think that's one thing we're going to chat about today. I do see a lot of different conditions, and especially some late stage breech babies, which I had about 4 just the other day alone. I think it came from you. So we're going to discuss about that as well on the call. I won't take up too much time with the presentation because I'm more than happy to just answer people's questions, especially if Johanna, if you've got any questions from yourself or your clients.
Absolutely, yeah.
So I'm located at Core Collective in Dempsey. So I'm there full time. Now I'm just going to go through, firstly, this may not apply for some, but number one, how can chiropractic care help before pregnancy, which is something I very strongly advocate for. And I do see a number of clients to help them fall pregnant. These days, more and more women are struggling to conceive naturally and more going down the IVF path. But one thing chiropractic care can help with is natural conception, or also helping prepare the body for IVF, which is something I've been doing with a number of my patients recently as well. So things that we can help with, one is promoting a more regular menstrual cycle, which obviously is going to help with natural conception. Promoting more optimal uterine function. So we do that through balancing the pelvis and sacrum and reducing the tension in and around the uterus. And then also preparing the body to be as strong as possible to carry the baby as well as conceive. For those that aren't aware, basically the body does look at a fetus as like a tumor and will try and get rid of it naturally. So it's really important that the immune system, both sides of the immune system, are balanced, which will allow a greater chance of holding the baby once you do conceive. So those are some of the more common things that I see and I help with prior to conception. Now, how can we help during pregnancy? So this is when I see most patients. Sometimes people are a bit concerned about coming in, say, during the first trimester, and they often ask, when can I come in? The answer to that is anytime. It doesn't change too much, whether you're at 2 weeks, 20 weeks, or 40 weeks, to be honest. So some of the things that I can help with during pregnancy, obviously, depending on the stages, but you can start to develop neck pain or back pain, especially more late stage pregnancy. So that's one thing that I can help relieve the symptoms or reduce the symptoms of. Obviously, as you go later into the pregnancy, you start to develop more instability as a relaxin hormone kicks in. So also helping to balance the pelvis and sacrum along with the spine, and make sure the pelvis is as stable as possible. We know that the posture does change. You start to get an increased curve through the lower back, and also even through the middle back as the breast milk starts to come in late stage. So trying to just work on improving posture as much as possible. And again, that ties in with the instability. So just working on allowing the body to be as stable as possible throughout the pregnancy. Now, there's a lot of research that shows that chiropractic care through pregnancy can promote an easier labor and delivery. And obviously, who wouldn't want that? So that, again, occurs mostly through allowing the pelvis to be balanced. Now, the pelvis forms the birth canal, so I can't demonstrate at the moment, but basically, if there's rotation through the pelvis, then that'll close down the birth canal, which makes it harder for the baby to progress through, and it can also contribute to breech positions. So balancing the pelvis and sacrum can help align that, allow the birth canal to open up as much as possible to then promote an easier labor and delivery. And then, as mentioned, minimizing aberrant uterine tension, fetal constraint, and possible malposition, which is all the breech positions. So the baby should naturally engage and turn into the correct position, head down, obviously. But sometimes if there's increased tension through the uterus, especially the uterine ligaments below the uterus, this can push the baby up into unusual positions and then result in your different breech positions. So as I mentioned before, I have seen a lot of patients with breech babies currently, and they are mostly late stage. But a lot of them have misalignment through the pelvis and sacrum, and also a lot of tension through the uterine ligaments and above the pubic symphysis. So we're working on correcting all of that to open that up, to allow the baby then to naturally turn into the correct position. I had one recently who came in to see me and was 37 weeks with twins. And one of the twins was sitting transverse. And she only saw her once, but she did message me saying that the baby did turn and she had a natural birth. So that was really good. And she was trying a lot of other things. And it's important to note that I'll also recommend different exercises and work in conjunction with other practitioners and gynecologists and obstetricians to help with that as well.
Amazing. I think I just want to add a little bit to the last point, which is basically the position the baby is in at the time of delivery. Because what I see often in the late weeks is, yes, we have a baby that is head down, but they're still shifting sides a little bit. And we do know from, experience and studies and so on, that those babies that start out on the right side of the mother's body often have a much longer labor. They have this transition to do going into a posterior position and then turning onto the left side. And I think that's absolutely to do with the tension of the mother and the baby is just trying to see where it can fit best in order to have a perfect launching position. So I think having this maintenance kind of care all throughout pregnancy makes a huge difference, because it does affect your birth outcome. It does affect how easily you will give birth, how long your birth will be, and then ultimately how many interventions you will have or not have. So it does definitely pay off to have that body work done.
Yeah, and then that's exactly right. And you mentioned as well, we're talking about breech, but it can help, reduce the incidence of cesarean section or ventouse or forceps and all of those other interventions as well. Anecdotally, I certainly see a difference with my patients. So for example, if I have patients that are already patients of mine before they conceive, they just naturally will come in throughout their pregnancies. And generally speaking, most of them have relatively straightforward natural births. Sometimes I have patients that I may not have seen through their first pregnancy. They come in throughout their second, and again, they have a much easier birth outcome. So we do certainly see it in practice. There is there is the research to support that as well. But you're exactly right, Johanna. The more we can look at it as just wellness care and being part of the overall, pregnancy package, so to speak, you know, in conjunction with exercise, in conjunction with your obstetricians, your gynecologists, your HANA, and everyone working together to get the best possible outcome where we can.
Mm-hmm.
All right, so they're the basics of pregnancy or chiropractic care during pregnancy. And then the other one is obviously post-pregnancy. So I do see most of my patients that come in during their pregnancy at some stage will then continue on because they do see the benefits. So again, relieving neck and back pain. We see a lot of mid-back pain through breastfeeding, the change in the mechanics through the spine. So that's a big one post-birth. Obviously, the body needs to recover, whether it's a natural birth or a C-section. So working to increase the strength and stability and assisting with a quicker recovery. And we do see that. And one of the big things I explain to my patients during pregnancy is the stronger you are prior to birth, the quicker you're going to recover after birth. And that's something that we really work hard on, not just from myself, but all the other practitioners we're working with as well, to allow them to recover much quicker post-birth.
Mm-hmm.
Another thing working on post-birth is improving pelvic floor activation. Obviously, that can weaken at times after the birth. So helping to improve that, which can then result in, less urinary incontinence and those types of things. And then also rebalancing the hormones as well as quickly as possible post-birth. So again, sometimes we are treating specific conditions, but it's more of a holistic approach and looking at the body as a whole and how we can just improve your overall health and well-being before, during, and after birth.
Mm-hmm. Can you explain a little bit, because I think a lot of people have this conception that chiropractors is all about, the cracking and so on, and they may not see the link to how can chiropractic affect the pelvic floor, which is muscles, which is very different from bones and your structure and your posture and so on and your alignment, as well as hormones too. So how does chiropractic, maybe you can even go a little bit into how does chiropractic work and how does it affect these things as well?
Yeah, so I'll talk a little bit more in a minute about the applied kinesiology side, but in terms of chiropractic itself, a lot of people think it's about the bones and the joints. As chiropractors, we influence the nervous system. That's the number one thing that we do. So your nerves, so your brain and your spinal cord is your central nervous system, and your nerves govern the function of every single cell in your body. Mm-hmm. So if we improve nerve function, then we not only improve joint function, but we improve muscle function as well. So by adjusting the spine or the pelvis or doing other corrections, we can activate the muscles by switching on the nerves that supply those muscles as well.
Got it.
You mentioned the hormones. Your nervous system supplies every organ and every gland. So the nerves come from your spine and then supply your ovaries, your uterus, cervix, all those types of things. So it's important that correcting spinal misalignments, pelvic misalignments, can help to rebalance your hormones from that perspective. But like I said, with the applied kinesiology work that I do, we look at it much deeper as well in terms of the hormonal pathways, particularly the stress pathways in the body. One of the things I see a lot of in terms of one, difficulty conceiving, or two, with say breech positions or malpositions, is there's a lot of stress going.
Mm-hmm.
Now that can be for a variety of different reasons, but the simplest way to think about it is if you are under stress, your body's going to shut down and close down, which is going to make everything harder. It's going to make delivering naturally harder. It's going to make your baby sitting in the correct position harder. It's going to make conceiving harder. So when you're under stress, and like I said, it could be work stress, it could be financial, it could be home, it could be anything. Basically, if you go into more of a fight or flight response, your body will send blood away from the center of your body to your limbs because you need to fight or flight. However, to reproduce, you need blood in the center of the body.
Yeah.
So that's another thing that I work on a lot with people is that stress response, trying to calm their system down through either some of the corrections I do. Sometimes it might be supplementation. We can still do a lot of supplementation throughout pregnancy. Obviously, we have to be mindful there's certain things we can't prescribe. but we can still do a lot of things, and also other techniques, whether that might be exercise, yoga, Pilates, meditation, swimming. All these types of things are really important as well, just to help calm the nervous system down and calm the body down.
Yeah. And I think that's really important to note, because a lot of people, yeah, as we said earlier, think of chiropractic to be body work. But I can't stress enough how much the parasympathetic and sympathetic nervous system play a big role in birth itself, and are antagonistic sometimes to the hormones that we need for labor. So if a woman is constantly in this, like you said, fight and flight response, her sympathetic nervous system is really fired up, the oxytocin just can't flow, because they just work in that kind of way that if an antelope, senses danger, she will run away to safety before she can actually safely birth her baby. And the same works in birth all the time. So if a mom is in this constant fight and flight, I see a lot of moms who go over their due date a lot, and they just can't get into that birth land, or whatever you want to call that, labor land. And also I see it with moms where their birth just drags out. It just doesn't, the contractions are kind of there, but they don't go anywhere. They don't become more intense. They don't become more frequent. And it's because this mom is constantly thinking, well, I'm not safe to birth. And that's where you can come in to sort of down-regulate all of that a little bit and say, okay, we need to find our way into the parasympathetic and be really relaxed, right? So
no, exactly right. And even if you're looking at just from a purely structural perspective, as chiropractors working on the nervous system, the adjustments take the body into a parasympathetic state. So sometimes patients after treatments will say, oh, I feel really tired. And that's because you're going into a parasympathetic state. The cutest ones are the kids that I see babies and children. Often the children, after I've treated them, will start yawning straight away. And sometimes babies will be asleep before they leave the practice because the nervous systems obviously don't have as many layers as ours do. And so you see those changes really quickly.
Amazing.
So the next thing, I think we've touched on it already, is can we help with breech babies? And the answer is yes. There are no guarantees with this. Because it can be a number of different reasons. For example, the uterus might just be really small and the baby might just be really big. So there could be structural issues that are causing it. But sometimes it can be more misalignments through the lumbar spine, the pelvis, and the sacrum, as I've mentioned. So what we'll do is help balance through there through different techniques, sometimes blocking, sometimes adjusting. Reducing tension through the uterine ligaments, okay? So it can feel side to side where the tension is and work to release that, which will help the baby just drop, decreasing the tension through the hips and the hip flexor muscles. Correcting cranial faults and TMJ dysfunction. So cranial faults, which the cranium is your skull, sometimes one or more skull bones can be out of sync with the others. And this I find a lot in women that have breech babies. Like we said before, everything works together. So it's important that the skull is working, because then cerebrospinal fluid can flow around the brain and the spinal cord. So working on balancing out the skull can often have a big impact with babies turning. Then also promoting an environment where the baby can just naturally turn into the correct position. I've seen a lot of really late stage breech in the last couple of weeks, sort of 37, 38 weeks. The later we are, obviously, the harder it is. It's not impossible. Johanna loves to test me by sending in a lot of late stage pregnancy, including getting women into labor and things like that. But ideally, we want to try and get patients in early, because the longer we have, the more chance we have of the baby turning. Now, obviously, sometimes you might not know until 34, 35 weeks that the baby is breech. So, but as soon as possible, getting patients to come in and working for as long as we can. But like we mentioned before, ideally, we want to get patients to come in throughout their pregnancy to hopefully prevent this from occurring in the first place.
Exactly. Prevention being better than the cure. Sorry, I've lost my train of thought. There was something I wanted to add, but go ahead.
So those are the main things that I wanted to just discuss in terms of chiropractic.
Okay, sorry, Daniel, it just came to me. Just to be clear, chiropractic to turn breech babies is very different from ECV, which external cephalic version. This is where, for people who don't know about this, but this is where your OB-GYN will scan your belly and see what the baby's lie is, where the placenta is, all of that, lube up your belly, and then basically manually turn your baby into the correct position. But chiropractic doesn't work like that at all. That is very different. You're not touching the baby and maneuvering them into a position, right?
Exactly right. And it's obviously non-invasive, nothing internal. Yeah, so it's more working with the body in terms of the alignment and structure, and correcting imbalances to help then the baby just naturally turn on its own.
I have a question from the chat. How does that process feel for breech turning versus chiro? Ash, do you mean the ECV? How does the ECV feel?
No, so I mean like via chiropractorship, like how does it feel? Is it like space creations, like an immediate feel? Is it like I'm not too sure the process. Like what are you aiming to do? Like opening more volume for the kid to move and turn? Just looking to understand.
Yeah, so again, without being able to show exactly, if we look at the pelvis as a ring structure, basically that's what forms your birth canal. So your baby's head is bigger than the birth canal. It's been designed this way because it needs to be compressed as it moves through there. But if we have any rotation or misalignment through the pelvis, then this birth canal will narrow. Okay, so when it narrows, then there's even less room again. What we start to see with that is some tension, like I said, through the uterine ligaments, which then can push the baby up into different positions. And that's how they either rotate, and they might sit transverse, might sit feet down. So when we do the adjustments and the corrections, again, all very gentle. It's just working on aligning the pelvis and the sacrum and reducing the tension, particularly through the uterine ligaments, so that the baby can then just naturally start to turn. You don't see babies turn there and then on the table. That's not how it works. Sometimes, like I've had patients recently, I had one where she said like her baby's being breeched and sitting in the same position the whole time. And she said that there's just no movement. The baby doesn't feel like she's moved at all. And since I've been working with her, she can feel a lot more movement through the baby with the baby. So that's the baby trying to turn. Sometimes, it'll happen between sessions. Like I might see someone one day and then 3 or 4 days later, I might see them again. And within that period, somewhere the baby has turned. Often at this point, working with your gynecologist, weekly to monitor the position of the baby as well. So yeah, so you don't see it turn there and then, and it's not painful at all. Yeah.
Thank you for your question, Ash. That was really good.
Any other questions, or you want me to move on then?
Move on. Let's go. Oh, yeah. No, thanks, Ash. Just thank you.
All right. Now, mention that I'm also an applied kinesiologist. So I'm the only chiropractor in Singapore that does the techniques that I do. I was trained in Australia and certified in Australia, and have been practicing for 17 years. Applied kinesiology, for those that don't know, is a unique healthcare system because we look at the body mechanics, the biochemistry, and the emotions to basically optimize your health and well-being. So we're looking at the triad of health. How does it work? So we mentioned before that the nervous system monitors and coordinates all of your body interactions. What I do is use applied kinesiology, which is muscle testing, to assess nervous system function and then find a solution to health concerns. So, for example, I might look in terms of your pelvis. I might challenge the pelvis in certain directions and look for where there's a weakness, and then that's the direction I need to correct in. The other thing is we can do testing after that to make sure the corrections have worked. So it's really good to pre and post test. What do we do? So we're highly skilled in the assessment and application of structural corrections, which is the adjustments, nutrition, which is something I do a lot of work with, diet and nutrition, craniosacral therapy, which we've discussed, meridian therapy, which brings in the acupuncture meridian points, visceral or organ therapy. So sometimes the organs might not sit in exactly the correct position as well. So sometimes we have to do manipulations through there, which again are very gentle, just done more with breathing. But one that I do find sometimes with women that are struggling with hormonal imbalances is either the uterus can be tipped or the ovaries might not be sitting in the right position. So we do corrections just to get them sitting where they should. Immune system function, retained neonatal reflexes is something I do with the kids, and many other health aspects. So these are some of the other conditions that I see other than just pregnancy. So musculoskeletal, digestive, immune, hormonal, dietary issues, nutritional deficiencies, and as we talked about, stress-related conditions. Now, all of these can relate as well throughout pregnancy. You know, if we're looking at what's giving your body the best chance of, say, you know, a natural birth, like diet's really, really important to make sure that you're not eating foods that are inflaming your body or not eating foods that you're reacting to. I have a number of different test kits in my practice, and I will place certain things on the body and test. So I've got different foods like gluten and dairy and eggs and soy and all the more common allergens that I can test on patients to see what they're reacting to. This one's a really common one when I'm seeing babies, especially that have colic. I'll check different substances on them and get mum to remove that out of their diet, which then often resolves the colic, dairy being probably one of the most common ones there.
Yeah, I was going to say that's really important to assess as well. But I like that holistic approach too in terms of fertility, because I think, as you say, there's not one modality that can solve your problems. It's so much more complex, and looking into the body as a whole and seeing what else could be going on is really helpful, I think. And I love that then people can just take charge. You know, when you send out a patient and they take charge of their condition or whatever and try to really affect a change in their lives is really powerful, I think. Can I ask you about the visceral work you're doing? Because I'm thinking any pregnancy is obviously displacing organs as well. And once the baby is born, we have this time in the first 6 or 8 weeks where the organs are trying to find their place again, right? And I think that rearrangement, that Jenga or whatever is going to happen there, might not always be successful, or I don't know. Do you think that causes for secondary infertility can often be that these organs didn't find their place to where they were before, or?
Yeah, look, and one of the advantages of the applied kinesiology and the muscle testing is we're just looking at your body specifically at that point in time. So like you mentioned, like organs will naturally just find their correct position. But if something tests up, then we can do the correction. So even not an organ, but the diaphragm is a really common one. And I see a lot of tension through the diaphragm when you're pregnant. So we do work just to release through the diaphragm. I've got digestive issues there. There's the ileocecal valve, which is a valve between your small and large bowel. That often has some issues with it. So I'll just do corrections just to release through there as well. So again, all very gentle, but making sure, just like you mentioned, the body's just working as it should naturally. There's always going to be things that are going to interfere with that, whether it's physical, you know, obviously through your pregnancy, still working. A lot of people are working in front of computers, desks, those types of things, the mechanics through the spinal change, but also too biochemically making sure that, you know, the diet and nutrition and everything's as optimal as possible. And then even emotionally as well. Obviously, there's a lot going on. So just working, I do different emotional corrections at times on patients where needed as well, because different organs relate to different emotions as well. You know, actually, you know, let's say, for example, a female's, it's her second pregnancy and the first one ended up being a C-section and she wanted a natural birth, and, you know, there can be the fear around the second one and all that sort of stuff. So, you know, there can be a lot going on. You know, I had a patient yesterday who I think's due I think she's due on Friday. And she's going really, really well. But even she said, you know, it's her first. She said, I'm just a bit scared, a bit nervous about how it's all going to work and that sort of stuff. So there can be a lot of things at play, obviously, especially the hormones are starting to, you know, to change a lot right towards the end.
Yeah, amazing. And I wanted to ask you too, because you're now mentioning C-section and so on, and you were talking earlier about the size of the head and the pelvis and how it's important that baby's cranium basically experiences that molding. Can you explain that process a little bit and how a vaginal birth is designed to, I don't know, activate certain processes and so on?
Yeah. So as I mentioned, the birth canal is formed by the pelvis. And naturally it is designed to be smaller than the baby's head. So when the baby goes through the birth canal, it'll compress the head, which then initiates basically a pumping mechanism. So we have our cranial bones, our skull, which basically expands and contracts in a similar rate to breathing. And what happens is when it expands and contracts, it pushes your cerebrospinal fluid, a fluid around the brain and spinal cord, around the brain, down the spinal cord and back up. And this carries lots of vitamins and minerals and hormones and neurotransmitters throughout the entire body. So this is a normal mechanism. If a baby doesn't go through the birth canal, for example, if it's a C-section, then this mechanism isn't activated naturally like it should. It'll still be there, but it's not activated naturally. And so invariably, I would almost say 100% of the time, I will see children with cranial foetal. So one or more bones will just be out of sync with the other. Now, sometimes you can visibly see it, like people will see the difference in head shape, okay? But sometimes it's not that visible. Sometimes it'll be a lot more subtle. But it can cause issues with digestion, especially colic and reflux and those types of things, constipation, diarrhea. It can cause babies to be really unsettled. I had a case a few years back. A little one was brought into me in just screaming, that really high-pitched scream where you just makes you shiver. It made me shiver. I was in with a patient and I heard her in the waiting room. And you just know this poor little thing's in a lot of pain. And she had some cranial faults, and within, I would say, maybe 6 sessions or so, she was coming in and she wasn't even crying anymore. So, you know, it's really, really important because also it works with, you know, turning the head both ways naturally, which can then affect breastfeeding, plagiocephaly, which is your flat head syndrome, peripheral vision, all these sorts of things. So just because there might be a C-section, it doesn't mean that's the end of the world. You know, we just see the baby as soon as possible and do the corrections where necessary. And sometimes even natural births will, you know, there might be a lot going on too. So I definitely advocate for newborns to be brought in as soon as possible. How soon? I've seen a 1-day-old baby. So it can be any time from when you're comfortable. Sometimes mums have confinement periods, so sometimes it has to be after that. But yeah, whenever comfortable. Most of the time, the newborns I see are between sort of 3 to 6 weeks because that's when they start to develop symptoms. But I can see them much sooner. Yeah.
Yeah, absolutely. And that's often the first time we feel comfortable leaving the house after a birth as well. Everything is a little bit disheveled after. Okay, we've got a question here. What's your recommended post-birth care in your practice? And can you talk about the difference between, because I imagine it's different for vaginal birth versus C-section?
In terms of treatment, there's not too much difference, to be perfectly honest. The only difference is if it's been a C-section, I won't do any manual adjustments to the low back for the first 6 weeks. And that's just a precautionary thing, like you're told not to drive or lift or things like that. Yeah. Otherwise, there's not too much difference in terms of my actual care, my treatment. One of the things that I want to do is get your body working as well as possible, as quickly as possible, and get you back on track. Now, that might be working with other people as well. Like there's some great PTs that are postnatal PTs that work in that space. There's some great physios that I work with as well, and we work together and refer patients to one another. It's important to try and get you back up and exercising as soon as possible. There might be some really gentle exercises that we prescribe. Yeah, so Restoring function is paramount, and a lot of that comes about from movement. So it's even through the adjustments in my treatment, restoring function is restoring movement through joints. So we want to get patients up and moving and functioning as quickly as possible, which will allow you to recover much, much quicker. Sometimes there might be more specific things we need to do. We mentioned pelvic floor, and there might be some specific pelvic floor exercises or other exercises. But generally speaking, most of the time, care is similar, whether it's C-section, natural birth. Yeah.
Right.
Again, it depends. Episiotomies can interfere with things, and there's a number of different factors at play. When I see a patient for the first time, obviously we'll go through and take a thorough history, figure out exactly what's happened, where you're at, and then treat accordingly.
Okay. Do you do much later down the line any scar work for moms who have had a C-section, because the innervation is obviously cut off through that incision? And what would that look like?
I think we've spoken about this before, and I'm glad you brought that up, because one of the most common things I see later on with females is low back pain because of a C-section scar. When we have any sort of injuries, whether this is an actual injury, a scar, even a tattoo or a piercing, all these things can actually cause it. The body remembers it, the brain remembers it, and so it can get trapped in your memory, and that can interfere with the neural circuits from the brain down to that part of your body. So if there's been a C-section, the first thing I would do is do the correction to the scar, which is a really simple reset. It's not massaging, it's not working on the scar in that way, but it's just a really simple reset neurologically. And that can make a huge difference straight away. And that's something I do first thing on all of my patients, whether they've got neck pain, back pain. We're always looking for injuries firstly. Sometimes injuries as well, there can be an emotional component to it. And obviously C-sections, that can be more prevalent. So working through and just resetting those pathways as well. Yeah. But thank you for bringing that up.
That's really interesting. A question we have in the chat is, how often do you advise to see a chiropractor in the second and third trimester?
Look, again, everybody's different. It depends on what you're presenting with. Some patients might be presenting with, quite severe low back pain, where I might start seeing them twice a week. Others might be coming in, for more of a checkup, where I might start seeing them once a week or even once a fortnight. Patients of mine that are just already regular patients, they might already just be coming in once every 2 weeks or every 4 weeks. And so we'll continue on with that through pregnancy. Normally in the last 4 weeks, I'll pull it back in and see patients once a week in the lead up to birth. But again, it very much is it's based on what you're presenting with, and every person is different. And my recommendations would be based on your case.
Yeah. Okay, great. And this is probably a good segue into chiropractors have this reputation of selling you a package of 20 sessions, and then you're tied in and you don't even know at the first appointment if this is a treatment that you will enjoy and or that will make any difference to your condition. So how do you work yourself as a chiropractor? Is that something you do, or is it only for convenience of the patient who has already knows that he wants to see you, 20 times?
I'm far more relaxed about mine. So I certainly don't push packages on anyone. I do have packages available that can be shared amongst family members too. They're there if patients want them, but if they prefer to pay per visit, that's fine by me. So yeah, there'll be no hard selling, no pushing, nothing like that.
Amazing, fantastic. Dr. Daniel, hi. Do you do side posture adjustment for pregnant mummies, or utilize the Webster technique on pregnant mummies?
Both. Yep. So I do a lot of side posture, which is the adjustments laying on your side. They can be done all the way up to birth. Some patients prefer not to be manually adjusted, and that's also fine. We have other techniques like blocking, and also something called an activator, which is more gentle. And then, yes, the Webster, that works with breech babies as well. So especially looking at sacral misalignment and the uterine ligament tension that we were discussing before. Yeah.
I know the Webster technique also as a sort of an induction method too. Is that true?
It can be, because again, we're looking at just getting the body working properly. You know what I mean? So I know that you've sent me patients before to try and get them into labor. Now, I don't necessarily use the Webster technique, but I've done what I need to do to correct the imbalances to then allow their bodies to start going into labor. And I think we had one go into labor 3 hours after she saw me. So yeah, so sometimes there are certain techniques, but it's more about, I use a lot of the applied kinesiology. It's more about just finding out where your body's not working and how do we get it working, because that's what will allow things to then naturally progress.
Great. Sorry, we've had so many questions now. I don't even know if we're at the end of your presentation yet. I think you've got more.
I've got a little bit more, but that's okay. I'll run
it.
I have mentioned some of this anyway. So we talked about diet, nutrition. Most chronic illness is due to inflammation, and gluten, dairy, and sugar are your big ones. So my advice, just some general advice, is those are things you want to reduce or eliminate. I find that a lot on my patients. Now, it might be 1 or 2 or 3, but certainly gluten and dairy are big issues these days. They affect the gut microbiome, which most people would know about, which then can allow more bacterial, viral, fungal, and parasitic infections to manifest. I do a lot of work in this space with my patients, especially here in Singapore. Fungal issues are a big thing because of the climate and mold and things like that. So probably about 1/3 to 1/2 of the herbals I use are safe to use during pregnancy and breastfeeding. So obviously we're only using things that we know and that have been proven to be safe. And also, people now refer to the gut as the second brain. So it's really, really important neurologically that the gut is working as well throughout pregnancy and just normally. Now, I've talked a little bit about babies as well and children. These are some of the conditions I see. So the reflux and colic, the flat head syndrome, ear infections, difficulty latching and feeding, constipation and diarrhea, disturbed sleep patterns. That's a really big one I see. A lot of kids get brought in just because they're not settling very well and not sleeping. And retained neonatal reflexes are more targeted at sort of, younger children and teenagers, not so much babies, because we allow the reflexes to integrate naturally first.
Yeah. The ear infections I find really interesting. Is this due to, do you help drain the eustachian tubes, or what is, because I understand that to be one of the main factors in recurrent otitis media, that you have that eustachian tube that is not draining into the throat. So I can imagine that chiropractic could work in this way.
Yeah, there's research to show that the recurrence of ear infections is so much less for kids that are under chiropractic care. It comes back to the cranial bones again. So the temporal bone and the jaw form the ear canal. So if there's dysfunction there, then it affects, like you mentioned, the drainage through there. And also with my applied kinesiology, working on the immune system and boosting immune system. I had a family I saw recently who were just constantly getting sick. And one of their little girls basically was only at school for 2 or 3 days at a time before she would fall sick and have another week or 2 off. And so I just put her on some supplements and did some corrections, and I think she went 3 weeks straight at school just after the first session. So yeah, it's really important that some of my herbals that I use are herbal tinctures, so liquids. So we can dose really, really low on babies, and then we can dose accordingly with children. So yeah, so that's how the infections work. Yeah.
Amazing. Great.
And so I think I've talked about the treatment as well in terms of the different ways that I treat, and also just looking at what your body needs at a particular point in time to get the best or the quickest results possible in the shortest period of time. These are just a few reviews, and then I think I'm done. But one of the babies that was brought in was having constipation, slow to crawl. After the first session, she did a big poo, which can happen sometimes, and started crawling. So the mum came in with her other child as well. And as I mentioned, she said none of them have fallen sick in almost 2 months, whereas they were getting sick every 1 to 2 weeks prior to that. So they were really lovely, and we can work with everyone. It's it's really important. I think one of the things with chiropractic care, and people say sometimes, oh, you know, you have to go to a chiropractor for life, et cetera, et cetera.
Yeah.
For us, it's about health and well-being. So, you know, like it's important to exercise all the time, not just for a month or two. It's important to eat well all the time. It's important to try and sleep well all the time. And for us as chiropractors, you know, we just fall into part of that. You know, we're not the most important part, but we're just a part of your overall health care. With other practitioners as well, you know, a lot of people that train regularly get a massage every month. So it's just important to make sure that the body's working as well as possible. If there's issues that arise, we correct them as we go. But for me, you know, I've seen this throughout my career with kids and adults that are regular chiropractic patients. They are generally much, much healthier. And we're working naturally. A lot of my patients not on any medications. You know, they're not getting sick that often. You know, they might have different issues at different times, but generally speaking, they are overall a lot healthier.
And this is so important. I mean, this comes up all the time in our groups that kids are just, they tend to be sicker than they were 20 years ago, I think. You know, I think it's our environment as well. And then obviously coming into a different climate too, you know, moving to Singapore is just a big, big change for many people. And then joining schools and whatever. So I think this will resonate with a lot of moms in our group for sure. Can I just quickly ask you one question that we had in the chat? Can you advise on the correct way to use white noise on baby? If mummies are unable to breastfeed, for the formula milk, should we avoid cow's milk, instead choose amino acid, rice formula, goat milk, or extensive hydrolyze? What do you think of that? Do you have an opinion?
Yeah, so generally speaking, goat's milk is the most similar to breast milk. So that is the one I would generally recommend. However, one of the things that if anyone does come in and see me, you'll see that I never guess. I'll never take a guess. So if a baby comes in and they're on formula, I'll get mum to bring the formula in and I'll test it on the baby to see whether they're reacting or not. If they're reacting, then yes, we need to look at changing it. Now, that might simply be to a different cow's milk formula, or it might be to a goat's milk formula. I have had the odd baby here and there that reacts to goat's milk. So there's no 100% perfect science with this. But again, I'm not one that likes to guess. I'm always about test, test, test. And even with foods, you know, we're always testing to make sure that we know. Like I've got patients of mine that they'll come in, they'll say, oh, look, I'm sick, you know, and I prescribe them something and I say, can I give this to my husband or my wife? And I say, well, I can't say yes or no because I haven't treated them. I haven't tested it on them. They might say different. So yeah, but as a general rule of thumb, yeah, the goat's milk was probably the one I would lean towards because it's most similar.
Yeah, interestingly, I've also seen with bottle-fed babies, or sorry, rather formula-fed babies, that they sort of tend to go off a certain the brand that they were taking really well for 6 weeks or 8 weeks or whatever, and then they can't tolerate it anymore, and then switching to a different formula helps as well. But obviously, if I can test, you know, what works best for my baby, that's obviously genius. You know. Amazing. Do we have any more questions in the sorry, you continue with the presentation actually first.
Just another one was just another lady brought in her daughter and with digestive issues and gassiness, and after a few sessions that disappeared, and obviously the baby's a lot happier. And that's one of the things when treating babies. Obviously, if they're not sleeping, mum's not sleeping, dad's not sleeping, siblings are not sleeping. So we can work on that, get the baby sleeping better or more comfortable. Often that affects the entire household as well. And then another one of my patients having a lot of gut issues ongoing for many years. And we really managed to get her feeling a lot better. Again, like we mentioned, testing different foods that she was reacting to. From memory, this one, she had a reaction to a chia seed pudding with almond milk. And what I got her to do was bring in chia seeds on their own and bring in almond milk on their own. And I tested both of them individually, and it was the chia seed that she reacted to, not the almond milk. So
Wow.
how specific we can get with it. I have patients bring different flours and different lentils and all sorts of things in, so we can be really specific with the testing as well.
Yeah.
So that's there we go, we're finished.
Great. Amazing. Thank you so much. Maybe stop sharing for a moment and we'll see if we have other questions in the chat. One thing that I've noticed over the year, noticed over the years and know is the difference, the correlation between a breech baby and hip issues. Is that something that you are seeing as well in your practice? And what comes first? It's the kind of the chicken and egg kind of thing, because I've spoken to some osteos that say the baby is in a breech position because of their hip issues, or do they get hip issues because they're in the breech position?
Well, look, it could be both.
Yeah.
Also, too, if you've got hip issues, you'll often have misalignment through the pelvis as well. So correcting the imbalances through there, as well as the hip flexor muscle. It all works together. It all works together. Which one caused which, that's probably harder to say. If someone has a long history of hip issues, well, potentially it's gone that way. Or if the baby was breech and then they've only just felt hip issues after that, potentially it's gone that way. It can go both ways.
Okay. Parents on the chat, any particular questions from your end? Loving your questions, by the way. They were all really, really good. But this would be your opportunity as well to speak to Dr. Daniel directly if you'd like. Otherwise, I'll look at I think I've asked all the questions that I wanted. I wanted to say something about breast size earlier because I've just had this mom who's, her breasts have increased so much, even in pregnancy, even before she started breastfeeding. And the impact that has on the back and her posture and everything together is just crazy. So I think getting some help for that is definitely good as well. And we know that in pregnancy too, people are struggling with so many different things. Like we see the people with the pelvic girdle pain and obviously posture, and some moms with the scoliosis as well. These are issues that definitely need addressing. Anything you can do for scoliosis actually through chiropractic? I mean, it depends on the degree, obviously, but is that something that
it does. It depends on the severity, number one. It depends on how long they've had it, like when did it develop, why did it develop. I've had some patients, we've been able to really reduce their scoliosis. And then there's others that there's not much that we can do in terms of reducing it, but we manage them through that, and getting adjusted regularly helps to improve and alleviate their pain and their symptoms. The key again, we talk prevention is better than cure. Generally, scoliosis develops in the early teenage years. So that's where we want to get kids. We want to check kids before it gets to that, to then make sure we're correcting misalignments and stuff. And there's also some nutritional issues at play with scoliosis. So to prevent it from happening in the first place.
Yeah. And do you assess things like milestones in babies? Like we were talking earlier about the crawling and that not happening. And I found it really interesting that constipation could play a part in that as well.
Yeah. Look, I mean, again, I'm not one that gets really caught up on they need to reach this milestone by this date type of thing, but generally, yes, they should. Sometimes with crawling, if they've got issues through their sacrums and their hips, then they potentially won't crawl. With babies, they don't necessarily tell you that something's uncomfortable or that they're in pain. They just avoid it.
Yeah. Okay.
It's our job to figure out what's wrong. And that's so, sometimes you'll see with babies, they don't turn all the way to one side. And that's simply because they've got an issue through the neck and it's just uncomfortable to go that way. So they avoid it. And so correcting the misalignment through the neck, not via any manual adjustments, by the way, in infants, can help just to get their neck turning both ways fully, which then can prevent flathead syndrome. So you can see how we can prevent things by making sure the body's working properly.
Yeah, amazing. A question in the chat was, anything hereditary you look out for to address in the baby?
Hereditary? Look, there can be, but, like most of the time people will know, but then if it depends on what we're talking about, that often needs to be done through the medical system, you know, through different testing and stuff like that. But certainly making sure you know, hips and things like that are functioning. I always, even if the hips often get checked at birth, but I will still check them myself as well. To make sure that there's no issues through the hips and things like that. I do have patients that have like thalassemia and things like that, which are iron issues. And so we work through that. One of my boys that I'm seeing, he has been low on iron for a long, long time. He's only 3. But we've managed to get his body to the point where his iron levels are normal and stabilized now. So that's been really cool. Great.
Amazing. Great. Mummies on the chat. Some have dropped off already, but thank you. If you have no more questions, then I think we'll end here. But thank you so much, Daniel, for spending your morning with us. It was really informative. And as I said earlier, we'll be sending out the link to the YouTube video later, so many other parents can watch it and then reach out to you. I'll be posting your details under the video as well. So thank you, and I hope you have a lovely day.
Thanks, Johanna. Thanks for having me.
Again soon. Okay, bye-bye.